Seth Katz, University Health, thank you for joining us for the RCM Innovators series.
My pleasure to be here.
It's great to have you guys in here. I know that University Health is considered a rather innovative organization. Part of the goal that we have with the RCM Innovators series is to find innovative providers and get their story, right? To understand what's happening inside that organization so that other providers can benefit from the path that you're forging. I want to hear from you. So what's the motivation for innovating in the back office of healthcare for University Health?
We're a very big hospital. We're what's known as an essential hospital, a safety net. It's a federal designation, right? So we take care of everyone regardless of their ability to pay. So our two biggest payers are Medicaid and people with no insurance.
Okay.
So our margins are very razor thin. I mean, a 1% operating margin is a phenomenal year. So in that environment, yes, it's very different than most other institutions. We used to joke, our CFAs joke, we lived on hours of cash on hand, not days.
Yeah.
And in that environment, you got to be as lean and innovative and nimble as possible because you don't have this big backstop of commercial insurance contracts and stuff where volume can get you out of a hole you're in. You got to be at the forefront of technology. You got to be first up. So, for example, over a decade ago, we outsourced and offshored our coding department. We're the first hospital to do that for your entire arsenal. We couldn't actually find many vendors who could support that at the time. Now they dime a dozen out here.
Sure.
10 years ago, that was new.
Yep.
But it allowed us to acquire the technology we need to keep them efficient, not worry about staffing and things like that. So we're very big at early adopters. Last October, we went live with some AI in our rev cycle. So very big about having to put in technology and processes that are going to make sure that we are as nimble as we can because our margin is just too small to wait.
So this is innovation by necessity for survival.
Correct.
But even when it's by necessity, as you say, early adopting is often considered to be a space with high risk, high reward.
Yep.
Now, reward if you succeed. How have you guys mitigated risk and ensured reward as you lead kind of in a mandated space of innovation as University Health?
I would say two things. So one, I always push back a little bit to say, if we can do it, anyone can do it. So when I hear we roll out some of this technology and you hear people say, I don't know, I'm nervous. I'm like, if our tiny hospital, not really tiny, but safety in a hospital can be successful in this, you don't need billions of dollars. You don't need to be Google to be successful in this, right?
Yeah.
So that's the first thing I would say. Secondly, you're asking how we go about it,
well,
or how you balance the risk.
Yeah. How do you mitigate the risk? Because if you are really going to be an early adopter, you're going to deal with risk. How do you deal with that?
I think a lot of it you got to accept it. You got to trust yourself. You got to go out there. You have to understand what you're talking about. So when we didn't know anything about AI, so when we started that journey, it's a steep learning curve. I went to Google University, YouTube University to learn as much as I could.
Wow, okay.
Got to hold the vendors accountable for what they're saying. But you got your stuff too, because you're right. At the end of the day, I'm saying we're going to sign with this company. I don't need to hire 7 more staff. We're going to automate doing prior authorizations.
Yeah.
No more humans on our team are going to do them. It's a massive risk. If it fails, that's payment, that's impacting care. Maybe we then have to go hire a bunch of staff. That is a challenge. You just got to accept it. You have to know your stuff and trust yourself that you did the right due diligence to say, I accept that this is the risk, but also know I want to be an early adopter. You're going to be doing this in 5-10 years anyway. So I'd rather get the better price, be the leader in this space than be a follower. And I know it sounds simple, but you got to trust yourself.
So as a key stakeholder within the organization, you took it upon yourself to become educated as far as the new technologies that were coming out. And that was how you were mitigating that risk. So you mentioned 2 things that you did. You studied with Google, and what was the other?
YouTube.
So you took it on yourself. What have you learned that you can help people sort of leapfrog the process? You send them to Google, YouTube. Where would you send them? How can they accelerate their process of learning to mitigate the risk of being an early adopter?
Yeah, absolutely. I think one of the biggest change, especially in this space, is a lot of buzzwords: AI, artificial intelligence, machine learning, RPA, robot process automation. They're widely different things.
Yes.
But people use them interchangeably. They're not. So that's what I understand. RPA it's a bot. I need someone to go check a box every 5 minutes. You don't need a lot of machine learning for that. It's just that's what you need. If you want to have your coding done by a computer, that's more like AI. That's more like IBM Watson winning at Jeopardy. It can read and understand.
Sure, yes.
So you need to go understand those differences because I think sometimes in sales pitches they use them interchangeably, and you want to be caught using the wrong piece of software then.
Yeah. So when you're in a conversation with a vendor, of course, they're going to use all the buzzwords. They're going to make every promise because you educated yourself on it. Now, how do you apply that education in your first, second, third conversation with the vendor to really vet out who can do what I need them to do, who can partner with me in the right way? How do you approach that?
First question,
Yeah.
especially if you're in this space, is so I need your system to go check these boxes, fill in this form. What happens if tomorrow that form changes? So I'm doing a prior auth. You got to go to Blue Cross's website. Here's the form.
Yep.
Tomorrow they change it. They move date of birth to the top for some reason. Is your system reading it and knows that page, so the fact that date of birth moved is not a big deal? Or is it, I got to relearn because now it moved?
Yeah.
That's the biggest difference. Because if they say, no, I got to relearn from each time, that's RPA.
Yep.
There's no AI in there. It hasn't learned a thing. It's just saying, I see the fourth field down as a date, and if that moves, I broke.
Yeah.
That's the first and biggest question to ask. What
Great
happens
question.
when something changes?
Yeah. So the difference there being the phrasing that I've heard now is RPA versus IPA, intelligent process automation, where you combine the artificial intelligence aspect with the process automation. It means it can self-adapt as things
Correct.
change. A lot of vendors making those promises as
are.
well. Have you picked up tools to help sort of separate the promisers from the actuals?
Yeah, I think so. I mean,
Yeah.
that kind of question I mentioned is a big differentiator. Right
Sure.
off the bat.
Yeah, that would.
And so, yeah, once you get into those kind of questions where you show them, hey, in REMR, things change pretty regularly. We take 4 upgrades a year. There's always changing screens. That'll get you pretty much where you need to go. I mean, you don't actually go too much deeper than that, because that'll tell you, look, either it gets you what you need, and then it's just a matter of, okay, what's the lead time to build it? How long does it take to learn the system? And then, what's my cost of ownership?
So when you're in such a mandated space, having to innovate regularly, I want to hear from you. How do you form relationships with vendors that go beyond strictly transactional? They have a solution, a service, a technology, you're paying for it. How do you build partnerships with vendors that become co-innovation partnerships? How do you do that?
Well, for us, it's a necessity. So I can't have, with our hospital and the way we're set up, we need people who want to be in our business. Like, we talk to vendors all the time, big, small. You're not going to make your 15, 20% margin on us. Like, you're just not going to.
Okay.
But on the flip side is 2 things. One, we might be one of the few hospitals, no disrespect to anyone else, if you're successful with us, you can feel really good about it. Like, you helped people who have nowhere else to go. And a hospital is their last resort for everything from just primary care, cancer care, end of life, everything. And it's a good feeling. Like, it looks good to have a partner like that. Number 2 is, we'll be one of the best reference partners they'll ever have. Because again, you can sign with a large Adventist, Mayo, Duke, and they're great. They do awesome stuff. Not very many institutions can do what they do. They don't have their resources. They don't have their time. They don't have their people, their money. But if we can do it, if this Safety Net Hospital in Kansas City, Missouri can implement this and have these successes, any hospital in the country can replicate that.
I totally get you.
So that's a selling point for them. Like, you want to be a partner with us.
Yep.
And you want us to be kind of your show hospital.
Yeah.
Because ours is a story that you can have people rolling their eyes. I'm not as big as Intermountain. I can't do anything about that.
Yes.
If a safety net can pull it off and be successful, you can do it too.
That's a really good point too, especially in the context of margin, as you're talking about, like razor thin to basically nearly non-existent.
Correct.
As a hospital would potentially use, we don't have the resources to invest in that kind of innovation right now. It's like, is that really true? Take a look at University Health. They've actually managed to achieve this and this and this,
Correct.
and they're really bringing intellectual honesty to what you're actually capable of. And then think about, are you in a situation where innovation is also mandated? Because it may not just be a function of how big is your margin. It can be a function of, we had Heather Kawamoto on earlier. She was talking about with CVS, Walgreens, Amazon pushing into the healthcare space. Every patient that a health system loses to a better experience that those organizations might be delivering, that's $1.4 million. The lifetime value of a patient in a system is $1.4 million. So as we're seeing it, it's not a question of, are your margins so thin you have to be aggressively innovating? It's, you better start innovating now because these pressures are coming after you. And as you're leading this sort of head of the field charge with this urgency, other organizations look and say, wow, I have to be operating like University Health. So I want to take the question inside.
Okay.
We talked about how you want to look for vendors that you can say the right kind of innovator. How do you look for people, right, to populate your organization? You have churn. Churn's been a big deal these days. You're trying to find people that can support this effort of innovation. What do you look for in the people?
You want self-starters. You need people who aren't afraid to go out and learn this new technology. Aren't going to be afraid to figure out, I don't know, some new vendor comes out with using blockchain for security. You're going to have to learn what that is. It's just the way the world works. I need people who are willing, who want to adapt, who want to learn new things, who want to challenge the status quo, who don't say, I don't want to learn it, it's not my job. every job's changing. Innovation's coming for all of us. and automation.
Yeah.
But I will say this, people get scared. They think about these things. They think, I'm going to lose my job and we're all going to be out of work. I don't remember where I heard, the thing was a TED Talk, but they were talking about Amazon, which you mentioned.
Okay.
They said, look, Amazon has more automation than anyone, and they keep buying more companies. They want to have drone delivery and all this stuff.
Yeah.
But they're on track to become the world's largest employer at the same time. This decade, they're supposed to pass Walmart. So what does that tell you? They might not need as many truck drivers or as many people in the warehouse, but they clearly still need a lot of people.
Yeah.
And the same thing, that's how we look at it in our rev cycle. Maybe I don't need as many people 5 years from now to call up and get a prior authorization because I've got automation doing that.
Yeah.
But I'll need them for something else, denials, cash posting, whatever else the case may be. So can you also have that forethought, and can I, my directors, to say, what's your team look like in 5 years?
Wow.
What's it like in 10 years? Because it's coming fast. If we already have this automation, it's only doing a few things for us today. 5 years is going to do a lot more. So you need to already be planning for that too. I need someone who's a strategic thinker.
Yeah.
I can sort of think outside the box of what is a new role in that world that we aren't even there yet, but I got to try to think ahead of, this is where we have to position ourselves. So you need someone who's very strategic.
It sounds like it's kind of pushing, it's pushing two different things at the same time. You are pushing into automation, pushing to bring in RPA, machine learning, artificial intelligence, but also upskilling your staff at the same time. So as you adopt these processes, processes into the technology side, how do I upskill the organization? So it sounds like each leader in your each departmental leader is charged with that. What are they doing? How are they upskilling as the technologies take over certain aspects of these roles? What is it the University of Health is doing to upskill, up-level the people to keep moving the organization forward?
Well, I think part of it is actually just following through with our mission. And that is, you hear about this all the time in clinical care, like letting doctors, nurses practice at the top of their license. Like, I don't want to pay a nurse to sit in a room to do a one-on-one with the patient. I can have a tech or something do that. Same thing in our position. We're paying people who have great skills at working with payers or finding denials, but they're stuck doing manual clicks in your system.
Yeah.
So part of it is just also getting out of their way. Like, let's remove that manual stuff. Let's let you focus on why we hired you, why we created this job in the first place.
Yeah.
The second thing is conferences and trainings and getting exposure to what else is out there. Being engaged in HFMA and groups and getting on listservs and stuff and sharing best practices and seeing what's out there. But like I said, a lot of it is just get out of the way. Take the stuff that's manual that they're stuck with today and just say, I want you to practice at the top of your skill set. Wow. And I don't want you clicking a button 7 times every time you have to complete the transactions. I want you to focus on how to improve that process, how to do, get us more cash, how to get, check our variances or whatever it might be in payments, and not as focused on what I think we do too much of, which is some of that administrative work, which is the way my system's built is I got to click a button 7 times to close out any account times, thousands a day. How much time are we wasting? And then we're not using those limited resources we have to the best of our ability.
Wow. So given the payer mix that you guys are dealing with, you may have a very different thought about this. I speak to a lot of providers that are dealing with, the major payers. And of course, the major payers are automating as well, right? Aggressively automating, bringing in artificial intelligence, robotic process automation. I've heard some of these providers, they describe it as an arms race, right? So like, who's just getting the better weapons? But you're dealing with a different mix of payers. Do you see it in the same way? Do you see it as an arms race? How does it look from your perspective?
Oh, for sure. I think, they want as many patients as they can in their group, and then they want to pay hospitals as least as they can. Mm-hmm. They want to automate, denials on their side. They want to automate. They want to get rid of their staff who have to process claims, who have to call patients. I mean, I get it. Every group is trying to get to that level.
Sure.
And what you can't, though, and what we still find is, you still need a human touch. And I know that's hard on both their side and our side, but, we can send text message reminders and we can send, notifications through their portal and all this stuff. The other day, you still want to talk to somebody. Yeah. And I think the groups that kind of went all in on technology and saying, I'm going to get rid of most of my staff and we're just going to automate stuff, a lot of them are starting to fail. Like, I know one group we used it with this kind of bad debt stuff. They said, we're only going to work on account centers if they have an email address. Yep. Because they want to automate. They don't want to have to call people. Their collections go low, and not all of our patients have email addresses, but they're losing other business because people say, you still need to follow up with somebody. You still need to call somebody. Sure. Like, shooting an email, it gets lost in spam and all this stuff. Like, you don't know if it's real or not. So I think there's going to be an overcorrection to some point if they're going to lean too hard into it. Yeah.
What are you currently excited about? New technologies you're looking at for University Health. What's on the list?
I love artificial intelligence coding. I think that's a huge space. You always see people struggling to find coders. It's a very niche market. It's very specialized. You have to have a special credential for it. And the rules, regulations about it keep getting harder. So automating that, I think, is a huge thing.
Sure.
And I think expanding some of the AI, like we're doing with prior authorizations, inpatient notifications, automating those clicks in the system so that people aren't having to take all that time. We're finally starting to hear, which excites me, that you always heard doctors saying, oh, how many clicks does it take me to do an order? How many clicks does it take me to order that procedure?
Yeah.
You never heard about the back office. You never heard them say, well, how many clicks does it take you to, close out an account, to post cash, to submit a bill? And now we're getting into some of that, which is really exciting for me. And then I also think it's the era of price transparency. I love that. Innovating on, look, we're a low-cost provider. We've been compliant from day one. We love it because we're gladly put up our prices against any hospital in town.
Totally.
But also using that now as a marketing way to help patients and say, look, we can be innovative in the offerings because we know we're low cost, we're high quality.
Right.
And in an era where you can now shop around a bit better, patients will have that kind of that consumer confidence to say, I know what things are going to cost me when I fell in the shower and I need an x-ray on my foot.
Yeah.
I can now go online, should be able to see what's going to get. Exactly.
Yeah.
If you're a low cost provider, you've got great technology, you have a seamless process for them, in our front and back office. That's the way you're going to get a patient.
So the more and more we push into price transparency, the better that benefits University Health.
100%.
Let me ask you about no surprises then. So again, because you have a different payer mix than most of the people who sit there, tell me what no surprises means to you guys.
It's a challenge, but it's a good one.
Okay.
We have a lot of self-pay patients, so we're doing a lot of good faith estimates.
Okay.
Probably more than most of the people who come through because that's such a large part of our payer mix.
Yeah.
So it's challenging, and I can't add staff to do that.
Sure.
So we have to add some technology and things to help generate those quotes more timely.
How do you add technology to address that?
So there are a number of vendors here. We partner with one that can help do that, can help integrate with our EMR that takes our data. So if I say I need a good faith estimate for a colonoscopy, instead of us having to kind of check boxes like we do today and manually build it each time, I can just type in colonoscopy, it pops it up, and I just hand it to the patient, email it, do whatever I can. There's still some work, you need a higher level in the clinics who know what they're coming in for to build it, but you can automate more of that. There's no more filling in the information kind of thing.
Yeah.
But at the end of the day, it's the right thing to do. It's very odd that in healthcare, we're the only thing in all of this country where it's like you show up and they're like, I'll send you a bill in 10 days and that's what you owe. I mean, if I need a new dress shirt, I can go to Target for $20 or JCPenney's for $50, or I don't know, go buy one from Burberry for $2,000.
Yeah.
But ahead of time, it's going to cost me $2,000.
Sure, yeah.
This, you think, oh, the hospital's down the street, I'll go get my x-ray. Then you find out it was $7,000 after the fact. So to me, especially people with no insurance, like, you should be upfront. They should know this information. And so when I hear hospitals say, oh, it's too much work, I'm like, please, if we can do it, you can do it too. But also, you should want to do this for your consumer. Like, imagine if McDonald's said, we're not going to post prices anymore. You're going to get a bill 2 weeks later, and that's what you're going to pay for your meal. Nobody would stand for that.
Right.
So why do we stand for it in healthcare?
Well said. Okay, we're going to give you the magic wand. 5 years from now, what's changing in healthcare?
I think that there's better collaboration amongst all of our vendors. I think information blocking has not taken its full effect yet, but for too long, people just haven't talked. And I wrote I think it was a blog post for AHIMA, I think for their journal one time about this, that, you and I can have an iPhone and an Android. I can send a text. It's going through. Hotmail, Gmail, email address goes through. I'm in Indiana. I can send money to India. No problem. But two EMRs sitting in hospitals across the street from each other have no ability to communicate.
Yeah, right.
And in many cases, their parent companies don't want to.
Sure.
And it's the patients who suffer. And so to me, that's the magic one. That's what's coming is these rules have to take effect. They have to put teeth into them and say, look, patients are suffering. Hospitals look bad because of it. You're adding more waste because we're having to request paper records and it's slowing care.
Yeah.
This just can't be. Like we're supposed to be so automated, and yet everyone's siloed in healthcare.
Sure, I get you.
And it's just not the way. Baking's not that way. Service industry's not that way, but we still are.
Yeah, and that's the one that always gets me is that banking is that way.
Yes.
And it's like, well, if banking can be, and we think about what would the most precious information in our lives?
Right.
Yeah, our financial and our health. Banking's got it figured out.
I mean, we used to joke. I mean, imagine if ATMs didn't exist, and I came and said, I have an idea. I'm going to take this computer, shove it in the wall on some random street corner. And you're going to stand there and take money. Like, you'd be like, what are you? You're silly.
Yeah.
But in healthcare, we're like, we can automate this. We can put in a health information exchange. And everyone shoots all their data, and then go back and forth and be like, oh, I don't want to do that.
Yeah.
Or some EMRs say, yeah, I don't want to connect to this one because you pay with that EMR, and we don't work in competition. It's silly, and it hurts patients. It hurts hospitals. We look bad because patients don't understand that. They're just like, well, why can't you see that information? I was there just 2 days ago. and that's what we have to solve. I think,
Yeah.
like we said at the beginning, hospitals, I think, do a very good job overall working together and trying to do the right thing. But in some ways, we're hamstrung by our partners who just don't want to.
So as you mentioned, other hospitals will observe you guys and say, "Oh, we can't do that." We've also seen or heard that the healthcare industry it's 10 years behind. It's even 20 years behind other industries. What is slowing us down? Why is it such a struggle to innovate at the same pace as other industries in healthcare?
I'll say two things.
Yeah.
One is it's very regulated. You might joke,
Sure.
Republican administrations like to cut regulations and Democrats like to add, except healthcare. Doesn't matter who's in power. There's always they're going to under the Trump administration. That's when price transparency started.
Yeah.
It's when No Surprise Billing. That's when first start getting rolling. So it is a very regulated space.
Yes.
It is very hard to keep up with.
Okay.
And each administration wants to do something different. And so you're kind of left on the fly trying to figure out what to do. I do feel bad when the Meaningful Use program started. That was almost 10 years ago now. But EMR vendors to quickly figure out, okay, here's this long list of requirements for the government. I got to build something that our hospitals can do. So in some way, there's always this chasing of what is the next regulation? How do we be compliant with it? So I think that's one of the biggest. And the second part is just, again, the competition. While there's a lot of competitions in banking, there seems to be a better recognition of, we want to get all the consumers in and work together, right? It's not like U.S. Bank says, I'm not going to send money to Citigroup or something. But in this space, you get that. You get our partners. You say, look, we'll innovate with you, we'll integrate with you, but I'm not integrating with them.
Right.
And so that attitude, and then just the constant state of regulation, it slows things down dramatically.
Okay, so if we're doing our job with the RCM Innovators series, this gets in front of a lot of providers, right? And a lot of them are in the situation you described. Oh, we can't do it, whatever, the challenges they're dealing with. What's your guidance, right? You're on the stage, you're in the room, you've got VPs revenue cycle, CFOs, CEOs. You guys are innovating. You're innovating by mandate, I get it, survival.
Right.
They should be too. What's the advice they need?
Just do it. Just stop complaining.
Okay.
I mean, it's just that simple. Like, yes, you can whine about a new regulation, but it's there. It's a rule. Just move on.
Okay.
I mean, I would just say, the other part is, if you want to be as successful as you are today in the future, because of price uncertainty, because of CVS, Walgreens, Amazon, Google, all these people, your patient isn't just going to keep coming to you because they came to you for 20 years before, or you're the closest hospital.
Yeah.
Once they see pricing, once they see how quickly can I get in, they'll go to what's easiest. If your hospital doesn't allow you to make appointments online or do all that stuff, they're going to find someone else who's going to say, I feel cruddy at 3 a.m. I want to be able to make an appointment for 9 a.m., get my meds and feel better. Not, I got to wake up, call, leave a message, go through a phone tree, get a call back. You're either adapt or die.
Totally.
And if you're seen as not being consumer friendly because you're not posting your prices, you're not trying to engage, the market's going to notice. And people are going to say, I don't want to go there. They're going to review you like Yelp and anything else and say, yeah, they're down the road, but I had a bad experience. This other hospital, they told me what my bill was going to be. They let me do everything online when I needed to. All the information was available.
Yeah.
That's where I want to go.
So I want 30 seconds to break the one thing down. Just do it is exactly the right phrase. I totally agree with you. But give me 2 steps to take. What are 2 things that they can do?
To do it?
Yeah.
So number 1, embrace a culture of patient first. That's what we're supposed to be. We're in healthcare.
Yep.
And secondly is, you don't necessarily have to find a vendor to do everything. There's a lot of stuff we've done in-house. We did price transparency without a third party.
Wow. Okay.
We built the files ourselves. It took a lot of time. But you can do it. That's the same thing. Like, you don't always have to just say, I got to outsource it. I got to find a third party. Trust your staff that they're going to be able to figure this out. And let them embrace kind of the new challenge. Like, give them the challenge of saying, here's the rules. Come back to me with the plan on how we're going to be successful. And I hate when people say, well, go put out an RFP. Like, trust yourself. As an organization, you can do this.
Wow. Really appreciate the guidance that you laid out for us here. Thank you so much for being a part of the series. Really appreciate it.
Happy to be here.